In this video, I will demonstrate the placement of a Neoss diameter 4.5x11mm tapered ProActive implant. For ease of use, the recommended drilling sequence and the twist drill depth measurements are clearly identified on the Neoss Clinical Organizer. We can see the recommended drilling sequence for the 4.5x11mm tapered implant on the Neoss flowchart. In addition, we can see the different symbols which indicate the recommended final twist drill in regular, soft or dense bone situations. It is important to note that the drill tip is 0.8mm beyond the drill depth marking. Drilling depths are easily identified on the twist drills by the 2mm wide bands. To start, there is a choice of either a lance drill or a round burr. The first twist drill will be the 2.2mm. Today we will also demonstrate the use of the Neoss drill stops. Drill stops correspond to the length of the implant you are placing, and simply twist and push onto the twist drill to prevent drilling beyond the required depth. Drill stops are delivered sterile and are single use. Following the 2.2 twist drill, both the depth and angulation can be checked with the drill depth guide. After the 2.2 twist drill, the next recommended twist drill is the 3.4 tapered. In soft bone situations, this would be the final recommended drill. In regular bone, the next step is to use the 3.9 tapered twist drill as the final drill in the sequence. In dense bone situations, we would recommend the use of the 4.1mm straight twist drill. There is now the option to use a countersink or screw tap. The Neoss ProActive Implant Kit contains 2 healing abutments of different sizes and a cover screw, as well as identification stickers for patient records. The lid of the glass vial is removed to expose the implant, which is picked up with the appropriate length implant inserter. The implant is then inserted. We recommend an insertion speed of 20 RPM. It is also recommended to start insertion at approximately 30 Newton-centimeters. And if the implant does not fully seat, then increase the torque incrementally up to a maximum of 45 Newton-centimeters. Once seated, a gentle rocking motion of the handpiece will release the implant inserter from the implant. Should it be necessary to manually adjust the depth, then the implant inserter is connected to the implant wrench adapter and, together with the ratchet, the implant is seated to the final position. To enable correct orientation of the Neoss acetaline anatomically shaped abutments, implant insertion components are laser marked to indicate when the implant is orientated or indexed to a correct position. Depending on the surgical procedure, either a cover screw or the appropriate length healing abutment is now placed. The Neoss ProActive implant is ultra clean with a super hydrophilic surface, which demonstrates rapid bone formation and proven long-term maintenance of bone levels. The ProActive tapered implant is part of a design evolution, utilising the main characteristics of the ProActive straight implant. This has resulted in an implant which has additional capacity in compromised cases and is ideal for installation in soft bone, including extraction sites.